Hi, Maggie. Do you have a chance? I wanted to talk to you about some of the issues that I have, concerns that I have about work.
Sure. What can I help you with?
Do you want to go to your office and make it a little bit more private?
Sure.
Okay, great. So I had an issue I want to talk to you about having 4 patients to 1 nurse and 1 tech. I think that's a little much. I wanted to see if we could try maybe 3 patients to 1 nurse and 1 tech. It's just when we have 4 patients, we are so busy and so swamped, we hardly get a chance to even sit down. Like last week, I took, we had 4 patients and it took a half an hour just to do vital signs because everyone had to get up and go to the bathroom at once. And so the time is not equally divided for the patients.
Okay, what are some, do you have like maybe some alternate ideas or, just something different that you might think might help?
Well, I was thinking maybe if we had 3 patients, or if that won't work, then maybe hiring another nurse. I know that the nurse, she's so busy that she doesn't have time to even interact with patients.
Okay. The reason, we're doing the 4 patients at a time or per night is because it keeps our costs down instead of having, 1, 2, or 3 patients per night. We're getting an extra patient in, and it's also boosting our revenue. So, maybe we could try having, I guess, an on-call nurse that if you really needed some help for a little bit, could call them in, someone that could come in within 10 to 15 minutes. What do you think about that?
Okay, so I understand that, it's a business and you're trying to increase the revenue and decrease the costs and taking advantage of having the 1 tech and the 1 nurse working. I do think that bringing in an extra person would help a lot. Maybe a little bit longer than 15 minutes, maybe 4 hours would help us through, especially through our busy session before we get our patients to bed and ready.
Okay. We could maybe try it out and see how it works doing, with the on-call when we have 4 patients and try it out. And if that doesn't work, then maybe we could just work out, something different in the schedule, just having 3 patients per night and just adding an extra night. So we'll just kind of have to play by ear. We'll try the on-call nurse first and then see. Are there any other concerns that you have?
Yeah, I was concerned about the patient's safety when we do have the 4, but if we're going to go ahead and try out the 3, then that would work. I was just concerned about the acuity and how the acuity of the patients. I know you guys tried to have us just with the less acuity when we have the 4 patients, but sometimes you can't predict the acuity of a patient. So if I have a patient who has a higher acuity with 4, the nurse and the tech are all busy with the higher acuity patient, and the other patients are left without having the proper care or the proper attention that they need.
Okay. So were there other patient safety issues that,
Yeah, I want to talk about the proper bariatric furniture that maybe we can see about getting. Having the proper beds and the chairs, I think is definitely of a safety issue for some of the patients.
Okay. I'll have to check the budget and see what it will allow for. Is there something that you need more than another?
Yes, I wanted to talk to you about getting a wider range of medications. We're limited on the meds that we have, and some of the patients are allergic to the medications that we have. So if we had a wider range, we could help manage their pain a little bit better, and it would be for safety and just for the all-around comfort for the patient.
Okay. Yeah, I'll look into that too and see what we can do. We'll see what the budget allows.
Okay, thank you.
Any other questions or concerns?
No, not right now. Thank you for taking the time to talk with me though.
Absolutely.
Thanks.
You take care.